All right, folks, with a population nearing 3 million people, over 400 children in Jamaica are born each year with a congenital heart defect. And since 2007, the Chain of Hope mission has been working to save lives at the Bustamante Hospital for Children. Lincoln Dean is the immediate past president of the Rotary Club of downtown Kingston, and Emma Scandon, chief executive of the Chain of Hope, and not for the first time here on Inspire Jamaica. Good morning to you both.
Good morning.
Welcome once again.
Thank you.
You live here in Jamaica, don't you?
We love coming to Jamaica.
But you've been, I said 2007, but you came here from in the 90s,
Sure.
didn't you?
Well, Chain of Hope has actually been coming to Jamaica since 1996. I first came in 1997. So we've been bringing the medical team down to do the surgeries on Jamaica children since then.
Where did that start, or how did that start?
Well, our founder, Professor Samagdi Yaqub, one of the world's leading pioneering heart surgeons, was coming down to Jamaica since the 60s. So he's been helping to develop the cardiac services here for over 40 years now, really.
Do you know how many children you would have looked at?
That we've treated over the years? Since 1996, we treated nearly 250 children through Chain of Hope. In 2007, what that date refers to is we set up Chain of Hope Jamaica, a local charity to help the local team at Bustamante Children's Hospital to develop the cardiac service and do the surgeries themselves. So we're trying to sort of mentor the professionals there to do the surgeries themselves and build the program, so eventually you don't need us coming in to do the surgeries.
Okay, and I'll get to Mr. Dean in just a second, because you recently came on board. Before that, the funding came from where?
Well, Chain of Hope UK funds all of the missions in terms of the equipment we bring down to do the surgeries. We bring heart valves that are needed down to do the syringes, everything, the drugs that are down here. We also raise money locally. Now we're building a cardiac unit with lots of other international stakeholders so that the infrastructure, both for Bustamante and the cardiac service at Bustamante, can be increased, and we can help bring the level of surgery in general up.
Yeah. And Mr. Dean, your service club's role now is just financial? You just...
We support them primarily with logistics. We assist them with
what, sir?
Transportation on the ground. It allows them to keep their focus on their substantive role, which is the actual execution of surgeries.
Okay.
We greet them at the airport. We ensure that they check into their hotels properly. We assist them with moving about. If they get a little time, we might help them to find somewhere to, you know, entertain themselves and so on, and then, you know, we make sure that they have a good time while they're here.
The kids now are just brought to the hospital, and then you grab the kids, or do they come specifically to you?
Well, again, you have a local team, and you have an excellent cardiologist for the last 25 years working on this program single-handedly, Dr. Charmaine Scott, who refers the children, and she works with Dr. Little and the others at the Bustamante. So they select the cases of priority, medical priority, and according to the expertise that are being brought in by the different teams as well. So, for example, Samagdi Yaqub was an expert in rheumatic heart disease, which is an unusual expertise to have. So some of the children that need their valves replaced from rheumatic heart disease, it's not just congenital heart disease, you have rheumatic heart disease here as well.
I think you mentioned a bit about it before, that you don't just want to come in and do and leave. You want to leave something here,
right,
don't you?
Right. And we just had two of physicians from Bustamante training with us in Chain of Hope UK for the last 2.5 years, and they've just returned to Jamaica. And they had many other offers to stay in Europe, but they're passionate about making the service work in Jamaica, and we need the whole of Jamaica to help us make them stay and make the service work.
Does that mean that there is an end date to what you're going to do? Or
sure. Well, we have an exit strategy in 5 years. We kind of, from next year, we want to make the missions much smaller, so the teams that are coming in, because you have a team locally on the ground, it's just really some mentoring in some of the more complex heart diseases that we can do, and really taper that off over the next few years. But the funding also, because we're funding some of the consumables that are very specific and very expensive for cardiac surgery, that's one of the problems.
Does that mean that you might move to maybe another island and do some good work there also, or no?
We're focusing on Jamaica, and there's a lot of challenges that we need to get over, like rheumatic heart disease first. So we may move to another island, but I think really what we want to do is develop the service here, not just for Jamaica, also for the other islands in the Caribbean. We've already started links with bringing persons in from Grenada and Trinidad to have surgery here. And we believe that Bustamante can be a centre of excellence for the Caribbean.
You've already suggested how the kids get to be helped. But what if someone watching now and didn't know about this? Could they just turn up at the hospital and say, well, can I be a part of this, or no?
I think in terms of if someone has a heart problem, the best thing would be to get in contact with their local health service, so there are referral points around the island to Bustamante. If they just turn up, they're not necessarily going to be getting through to be seen in the clinics on the day. So one of our plans is also to do outreach clinics with the local clinicians when they get some time, because they're overrun as it is, but to reach more around the island.
Your role now, does that have an expiry date on it? Or
well, our role will continue as long as the society needs us. We work in collaboration with the Jamaica Urban Transit Company. We work in collaboration with the Airports Authority of Jamaica, and we have a number of other partners that we also work with. And as long as they support us, we'll continue to support the Chain of Hope mission.
Okay, great work. Emma Peel, great to see you once again.
Good to see you again.
Great to see you once again. All right, Lincoln Dean, immediate past president of the Rotary Club of Downtown Kingston, and Emma Scanlon, Chief Executive Officer of the Chain of Hope.